What is vitamin D's role in chronic disease prevention? Imagine a nutrient that influences more than just your bones and immune system, something that plays a part in maintaining overall health and possibly reducing the risk of long-term illnesses. That nutrient is vitamin D. It is a fat-soluble vitamin that your body can produce when your skin is exposed to sunlight, specifically ultraviolet B rays. It can also be obtained through dietary sources such as fatty fish, fortified dairy products, and supplements. Vitamin D's primary role is to regulate calcium and phosphorus levels in your blood, which are essential for healthy bone formation and maintenance. However, its functions extend far beyond bone health. It acts as a signaling molecule that interacts with vitamin D receptors found in many tissues throughout the body, including the immune system, cardiovascular system, and even certain cell types involved in cell growth and differentiation. Research has indicated that adequate levels of vitamin D may be associated with a lower risk of developing certain chronic diseases. For example, in the realm of immune health, vitamin D enhances the pathogen-fighting effects of immune cells and modulates inflammatory responses. This modulation can potentially reduce the likelihood of autoimmune conditions such as multiple sclerosis and rheumatoid arthritis. In terms of cardiovascular health, some studies suggest that vitamin D deficiency correlates with increased risks of hypertension, heart disease, and stroke. Vitamin D may influence blood vessel function and inflammation, both of which are critical factors in cardiovascular health. While the exact mechanisms are still under investigation, maintaining sufficient vitamin D levels appears to support vascular function and reduce inflammatory processes that contribute to atherosclerosis. Chronic diseases like type 2 diabetes have also been linked to vitamin D status. Evidence suggests that vitamin D influences insulin secretion and sensitivity, which are vital in managing blood sugar levels. Adequate vitamin D levels may help in reducing the risk of developing insulin resistance, a precursor to type 2 diabetes. Furthermore, some research points to a potential role of vitamin D in reducing the risk of certain cancers, including colorectal, breast, and prostate cancers. The vitamin's influence on cell growth regulation and apoptosis, or programmed cell death, could be mechanisms through which it exerts protective effects. In summary, vitamin D plays a multifaceted role in maintaining health and potentially preventing or delaying the onset of several chronic diseases. Ensuring sufficient levels through sunlight exposure, diet, and supplementation, when necessary, can support overall well-being and may contribute to long-term disease prevention.